Hello everyone, greetings from Gunjan IVF World. I am Dr. Garima Sharma, IVF consultant gynecologist, Gunjan IVF World, Janakpuri branch, New Delhi. So today I will be talking about some most frequently asked questions about infertility. So whenever a person faces this thing or something thoughts come into their mind, there are few questions that strike into everyone's mind, and I would like to answer those. So first, the question that comes into mind is, what does infertility means, and does that mean that I can't conceive at all? You should not confuse fertility with sterility, infertility with sterility. So infertility is something we call this as now subfertility. That is, if you are being trying to conceive for about 12 months of duration without any use of protection and still you are not able to conceive, so we call you as a subfertile person. Now, it's not that you won't be able to conceive at all, but you may need some assistance in conceiving. So therefore, we call you as a subfertile person. Sterility means that there is some reasons, either your uterus is absent or your ovary is absent, or your testis, the sperm production is at least zero. Then we call it as sterile, that is, you can't conceive at all. So there is difference between infertility or sterility. Sterility is meaning that you can't conceive at all, either because of absence of uterus or your ovary is not functional, or there is some problem in the male partner if the testis is not at all present. Then the second question that arises in everyone's mind is, how common is infertility? So actually, infertility is quite common. Around 1 in 8 person face this problem, couple face this problem, and they have to deal with it because of increased stress and lifestyle, and we are busy in our own careers and we want our own financial independence. So there is a rise in infertility, and around 1 in 8 couple face this problem. Then the next question is, so is this a woman problem? So whenever a couple is not able to conceive, most of the society thinks that if there is some problem in the woman, that's why they are not able to have a child. But about 1/3 of cases, the problem is with the male, that is, the male partner has the problem. So if we classify, 1/3 of problem happen in female, 1/3 is in male, and in 1/3 of cases there are both male and female partner has some problem. So if you are not able to conceive, then we generally test both of the partners, the male and the female partner, because the problem can happen in any of either of it. And then the next thing that arises in anyone's mind who is trying to conceive is, how long should I try to conceive before going to the doctor? So if you are less than 35-year age and you have no other history, then you should try for about 12 months without using any protection. And if you are not able to conceive in this 12 month of duration, then after 12 months you visit a fertility specialist. But if your age group is more than 35, then within 6 months of trying, if you're trying since 6 months and you are not able to conceive, then you should visit the fertility consultant for getting a proper diagnosis. So for less than 35, it is 12 months, and for more than 35-year-old female, I'm talking about the woman age, it is more than 6 months if you're not able to conceive. Then what are the signs and symptoms of infertility? Means when should you bother that you may have problem in conceiving? So there are some signs in female partner, and there are some signs and symptoms in the male partner. Most common symptom of female partner is if she is having irregular cycles, means her cycles is not regular. That means she may have some problem like PCOD or thyroid issue, hormonal imbalances, why her cycles are irregular, or she has painful periods, extremely painful periods, or if her cycle is abnormal, means she's having irregular bleeding, spotting. So if she's facing period problem, that is one of the symptoms. Or if she has extreme level of hot, if she has hot flashes, this is a symptom of ovarian insufficiency, means if she's facing hot flashes, that is also, or if she's having extreme weight gain or extreme hair fall. So these are symptoms that indicate hormonal imbalances. So if you're facing these problems, you may have problem in conceiving. And similarly, in case of male, there could be like if there is difficulty in ejaculation or erection, or there is any swelling or mass in the testis area. So this can indicate that the male can have problem in conceiving, or there is the sexual desire is less. So this could be either in male or female. So this can indicate some form of it can be a symptom of infertility. So the next most common question that arises when you deal with infertility is, does women's age affect infertility? Yes, women's age affect your fertility. So a woman is born with certain number of eggs, and they as you age on, these number of eggs decreases. So after 30 years of age, the number of eggs decreases, and after 35 there is a sudden fall. So therefore with age, your number of eggs as well as the quality of eggs also decreases. Similarly, if the next question arises that does age affects fertility in case of men? Yes, though the age is more important for the female partner, but for the male partner also the age affects. After 45 years of age, the semen parameters also changes. So in males also the age plays an important role. So the last question that arises, what are the methods of treatment for infertility? So the methods of treatment depend on what are the reason why you are not able to conceive. So if you are not able to conceive because you are not producing eggs, so we have certain tablets which will help you in egg production, and thus you will be once the eggs are produced, we will be telling you what are the time in which you should have intercourse so that you can have a baby. And then other options are like intrauterine insemination, in which the husband's semen is inseminated into the uterus, and this requires your tubes to be patent. And the final treatment, if the tubes are not functioning or other treatment have failed, or if the problem is with the severe male factor, then we have IVF or intrauterine in vitro fertilization. So these are the basic methods that are there for the fertility treatment. So I hope this video have answered some of your queries about infertility, and if you have any other query, please do comment in the comment box. Thank you.